This is Kayla and Allie, and we're going to be talking about Ginkgo biloba. So, Ginkgo biloba is a supplement that is extracted from tree leaves, specifically the maidenhair tree, and you can extract the supplement and use that for various reasons, and then use the dried leaves for tea. And it originated in Japan and China, and we'll kind of go through the different areas that it may be used for. And the primary indications or effects include memory and cognition, specifically for Alzheimer's, increased vascular perfusion and of brain and other tissues, antioxidant increase, and then as an anti-inflammatory as well.
So, who would use this would be people with dementia. It's thought to believe to help with circulation in the brain. More recent studies have shown that it helps to protect the nerve cells from damage in Alzheimer's disease. And this is looked at specifically in older adults, and it helps improve their ADLs and other behaviors. Long-term use does not prevent the onset of Alzheimer's disease, so you couldn't be taking it if you wanted to just prevent it. It'll just help while you have the disease, as it is protecting against the nerve damage. Some other benefits include improved thinking and memory, which is the cognition aspect, and that's due to increased cerebral perfusion, as well as better social behavior, better ability to perform everyday tasks, and other research suggests it may not improve function in otherwise healthy people. So other individuals that would use this would be individuals with anxiety. It could help relieve this, but it should not be taken with Xanax, as it could reduce the drug's effectiveness. And other studies have shown that it improves vision with people with glaucoma as well.
So, as previously mentioned, the effects that are from this supplement can be used to treat blood disorders and memory problems, specifically to increase blood flow and slow down the rate of memory loss with people with dementia, and then can also be used for the enhancement of cardiovascular function and eye health.
When this supplement is combined with other drugs, it could have some adverse side effects, such as when it's combined with ibuprofen. Ginkgo can increase the risk of internal bleeding. It can also have an adverse effect when taken with SSRIs or MAOIs. It may inhibit blood coagulation in some patients, and there's a caution with it with taking heparin, warfarin, aspirin, and other NSAIDs. And side effects of Ginkgo biloba include nausea and vomiting, diarrhea, dizziness, headaches, stomach ache, and restlessness.
When this supplement is specifically taken for anxiety or depression, there should be some caution when taking this because, like we said, it can have an adverse effect when taken with an SSRI or MAOIs. When you take it with an SSRI, it kind of has the same effect, so it's going to increase serotonin in the body. And so you can have serotonin syndrome, and that is just increased levels of serotonin, so your body is overwhelmed with serotonin. And this is characterized by rigidity, tachycardia, hyperthermia, which is high body temperature, restlessness, and diaphoresis, which is excessive sweating. And as we know, serotonin kind of regulates your mood and digestion. And so if you have extra serotonin, it's just going to exaggerate all of these things. And then with MAOIs, can enhance the good and the bad side effects, so it'll exaggerate everything. In this particular study, titled Limited Cognitive Benefits in Stage 2 Postmenopausal Women After 6 Weeks of Treatment with Ginkgo biloba, they had a placebo group and then a control group, and there were no significant changes except for those that were significantly lower in scores at the beginning. It had no effects on mood, and the benefits appear to be reduced after 6 weeks of treatment. So only if the patients were severe in their symptoms when they started the treatment, then they saw effects. But If they just had, if they were in the early postmenopausal stages, then they didn't really see any effects with taking the supplement. And then after 6 weeks, they didn't see any um, benefits of taking the supplement.
I looked at a study that looked at the effects of the Ginkgo biloba extract on experimental cardiac remodeling. And as we know, there's the type 1 and type 3 collagen that are in the heart. And if there's a disbalanced ratio, which is increased type 1 to type 3, then there's decreased ventricular compliance, increased wall stiffness, and diastolic filling limitations. And there were 20 rats divided into 5 groups. One was just a control, the other one had an induced myocardial infarction, and another group had the MI plus aspirin, and another group had the MI plus the captopril, and the last group had the MI plus the ginkgo biloba extract. And what this showed was that the last 3 groups with the aspirin, the captopril, and the ginkgo biloba extract all showed reduced expressions of the type 1 collagen. And pretty much what this showed was an inhibition in the experimental rats' myocardial remodeling after acute MI, and this decreased the expression of the type 1 collagen. So with that, then they didn't have the adverse effects with the ventricular compliance or the wall stiffness as when the control group did, as you can see in the pictures. There's a decrease in the type 1 collagen, which is what we want, or else you're going to have that stiffness within the heart. So you can see in the graph in like the bottom right corner, it goes through the groups, but you can see that there's the decrease. So the dark black is at the 4-week mark and the white is at the 8-week mark. So you can see that the decrease in the collagen is being formed overall, which is better and overall beneficial to us. Another study I looked at was with schizophrenia and the Ginkgo biloba extract. And what it came up with is that there's an increase in antioxidant enzyme when the Ginkgo biloba extract is taken with an individual with schizophrenia. It also looked at those with ADHD, and it helps with the protection against the neural damage caused by antipsychotics and for the treatment of depression as well. And I looked into further detail about this as there wasn't much evidence provided about it. And the antioxidant enzyme is a defense against the free radicals. It has been reported that the most important source of free radicals is the glial cells that we previously talked about in classes, and the free radicals produced by the cell group are related to the neuropsychotic disorders. The importance of the free radicals in schizophrenia subtypes reported that oxidative stress might have a pathophysiological role in the subtypes of schizophrenia. And oxidative stress is what happens when your body does not have enough antioxidants to neutralize the free radicals. Free radicals are the unstable molecules that react with other substances in your body to damage cells or create abnormal ones. So overall, the importance is the antioxidant defense mechanism that might be impaired with the schizophrenic patients. And when taken with this ginkgo biloba supplement, then it helps with the increasing the antioxidative stress enzyme. And as you can see in the picture, there's disease-related that would induce the oxidative stress. And in the study, you can see that how the oxidative stress would affect the brain with the schizophrenia. And then I also posted a picture on the bottom right corner of how oxidative stress would affect the cell as well.
So for our recommendation, there are many places that support the theory behind this supplement. However, there's not strong research behind the supplement proving the effects. So at this time, we would not recommend this without contacting the patient's primary care provider first, and just because there's not enough evidence to support it, nor is there enough evidence explaining the pathophysiology of the supplement and proving that what the theory behind it is actually true, and that's what it does. Most of the studies have been tested on rats, but they're still unsure if they have the same effects in humans.
And these are our references.